Hello, everyone. My name is Selena Yassin, and I'm the Director of Communications here at Adapt Community Network, and I wanted to welcome you to Benefits 101. A couple of housekeeping rules. Please put any questions for the presenters in the Q&A. To ask a question, simply click on the Q&A icon towards the bottom of your screen, type your question, and hit send. The chat box will only be used to post information pertaining to Adapt Community Network and this webinar. Information about how to access translation will be available in the chat. Please make sure your questions are general in nature, as this webinar will give general information only and will not address specific cases. In the interest of privacy, please do not include personal information. If you're having technical difficulties, there will be answers to shared questions in the chat section. This is being recorded and you can watch it again at www.adaptcommunitynetwork.org. Also, please be sure to follow us on social media at Adapt We Change. It is my pleasure to welcome you to today's session featuring Lisa Brown. Lisa Brown is the Assistant Director of the New York Employment Services System and provides training and technical assistance, resources, and supports for SSA beneficiaries and service providers. NYESS is a resource for all things related to employment services, and as a team, NYESS promotes principles, practices, and policies to improve employment outcomes for individuals of all abilities in New York through collaboration with state agencies, service providers, and advocacy organizations. Lisa has been involved in employment and rehabilitation services for individuals with disabilities and barriers to employment for over 20 years, including over 10 years with vocational rehabilitation services, serving both Indiana and Colorado residents. And she was an adjunct professor for 9 years, teaching psychology and student success courses. Please join me in welcoming Lisa Brown.
Thank you very much, Selena. Thank you for joining me today. I'm going to go ahead and share the screen so you can see the PowerPoint. And it's my understanding that you will get a copy of the PowerPoint following the presentation. There we go. So thank you for joining me this afternoon. One of the things that NICE gets is a lot of questions about benefits. So individuals who are trying to go to work, they want to know how benefits are going to be impacted when they do go to work. And so this information today is general information about benefits planning. If you have specific questions, I would just suggest that you reach out to me and I can help you navigate those questions or connect you to someone who can. So today, these are some of the topics that we're going to cover. We'll talk about the New York Employment Services System, which is where I'm at, and it's called NICE. That's our acronym. We want to talk about why employment is a good idea. And there are some myths and facts out there about a person who goes to work and has benefits and how that might be a myth that we need to talk about. We are also going to be talking about the two Social Security benefit types, SSI and SSDI benefits. We'll also cover ways that individuals can maintain their healthcare coverage, including Medicaid 1619B, the Medicaid buy-in for working people with disabilities, and Medicare coverage. In addition, individuals who are receiving benefits or who have disabilities can actually save money, and there are two ways to do that. One is through an ABLE account, and one is through a PASS plan. So we want to talk about those two options. In addition, there's a section here about certified benefits advisors. So anyone who is receiving any type of public benefit should be connected to a certified benefits advisor. And we'll talk more about that. In fact, that's my 5-minute commercial in every training that I do. It's so important for you to connect with someone. And then we do have some resources to share with you at the end. And as we jump right in, the New York Employment Services System is a statewide partner with all of these agencies on this slide. And our closest partner is the New York State Department of Labor. And we, the New York Employment Services System, is housed within the Office of Mental Health. And a long time ago, the Office of Mental Health and the Department of Labor came together and recognized that there was a gap of employment resources throughout New York State. And so the New York Employment Services System was created, and that's our whole purpose. That's what we do. We do have other things that we manage throughout this network. We are, as I said, a statewide partnership, but we are also a collaborative employment services case management system. It's a data system that we use. We are also one of the largest ticket to work administrative employment networks in the country. And we are a primary employment services data source. But our primary focus remains being a resource for all things related to employment. So what that means for you is if you have questions about employment services for individuals, please give us a call. We'd be happy to talk with you about it, offer some referrals, or point you in the right direction. So please feel free to reach out with any questions that you have anytime. One of the next topics that comes up frequently is, if I'm on benefits, should I really go to work? What would be the benefit of going to work? And so as we talk to people, we want to make sure that we're talking about the benefits. So employment is really a good idea for individuals. And researchers have determined that employment is a social determinant of health. And there are so many different areas of your life that are impacted by this. So your financial health is going to be better. You're going to have more money. The physical and mental aspects of your health will get better. There will be an increased socialization, gives individuals a meaningful activity, increases a person's self-worth and work ethic, and overall, just an improved quality of life for people. So work can be very beneficial for individuals. In fact, sometimes there is a reduction in the need for interventions, medical or physical interventions, sorry. So it's really important to know that going into it, there are some very positive aspects about employment. Another question that comes up is, should I go to work while I'm receiving public benefits? And yes, working while receiving public benefits is a good idea. And you don't have to be a benefits expert, because there are people out there who do that. That's called a certified benefits advisor. But it's important for you to understand a little bit of information. So individuals will have more money in their pocket, and they will not be penalized for working while they receive SSA benefits, but they have to report their income on a monthly basis. So wages must be reported in all scenarios to reduce the possibility of an overpayment or any other related penalties. But if overpayment should occur, a certified benefits advisor can help that individual navigate through that process. There are also some common anxieties and frustrations associated with public benefits, and those are real, and they need to be a part of this conversation about going to work. And so the question is, who can you talk to? Oftentimes, all state agencies across New York State have different eligibility criteria. So it's frustrating sometimes to think that you're on track for this particular benefit, but by doing this and meeting this eligibility requirement, that may impact a different benefit. And so having everybody on the same page and talking about all of the benefits is really beneficial. And there are many common myths about what happens when somebody on public benefits earns wages, and those aren't real. And so we need to also include those in our employment conversations. And we'll talk about what those myths are. So as I mentioned, there are a lot of myths, but today we're just going to talk about 4 that are very common. Traditionally, it takes a long time to obtain SSA benefits or other public benefits. So individuals are sometimes anxious about going to work with the possibility of losing those benefits. Additionally, sometimes family and friends have heard stories or rumors about individuals who go to work and then they lose their benefits. And then as a result, they don't encourage individuals to pursue employment. So we want to talk about what those myths are. So maybe we can dispel the myths and make people feel more comfortable about going to work. So one of the myths that comes up is I can only work 20 hours per week if I want to keep my benefits. And that might be one variable in being able to keep somebody's benefits, but there are several variables out there involved. And it's not just about the number of hours. So it could also include the specific benefit type, if they're getting SSI or SSDI benefits, and hourly wages make a difference. And individuals may be eligible for work incentives, which would allow them to maintain their benefit longer than otherwise without. So again, a certified benefits advisor can provide that clarity for your specific situation. Another myth is I have a disability, so I can't go to work. Well, one of the interesting things that occurred years ago was Social Security recognized that individuals with disabilities can work. And so they have created what's called the Ticket to Work program to encourage individuals to go to work and help gain financial self-sufficiency. So the individual can be eligible for the Ticket to Work program if they receive SSI and or SSDI benefits. They also have to be between the ages of 18 and 64, and they want to go to work. Now, this is a voluntary program where you can receive employment services at no cost. But being voluntary, that means you don't have to participate in it. If you decide not to participate in the Ticket to Work program, it will not impact your benefits at all. Another myth that we come across is I can't work until I'm considered stable by my treatment team. So this is a myth that individuals have to be considered ready or stable or even compliant with medications before they go to work, and that is just not true. So there are a number of supports that can be available to help a person obtain and maintain employment, even while they are managing specific barriers to employment. So they could be experiencing mental health symptoms, housing needs, transportation, or even educational needs. But having the correct supports in place can help that individual be successful regardless of being, quote, ready to go to work. In fact, some individuals are even homeless, but they can find a job and they can maintain that employment with the right supports. So it's really important to consider that a person doesn't have to be ready, stable, or even compliant before they go to work. And the last myth we're going to talk about today is if I go to work, then I'm going to lose my healthcare benefits. But I want you to know that there are ways for a person to maintain both Medicaid and or Medicare benefits if the individual goes to work and they earn more than the allowable by the benefit type. So today we're going to talk about the Medicaid 1619B, the Medicaid buy-in for working people with disabilities, and how a person can keep Medicare coverage. This next section is going to just dive into benefits, so SSI and SSDI, and the specific work incentives that are associated with each benefit type. So SSI and SSDI are separate Social Security benefit types, and they calculate wages in very different ways. But in either case, working is still a good idea. Again, my little commercial, please consult a certified benefits advisor to help the individual learn how working will actually impact those benefits. Another important thing to know is that if an individual earns enough for cash benefits to stop, there are still ways to continue to receive free Medicaid, premium-free Medicaid. The first is the 1619B of the Social Security Act, and the next is the Medicaid buy-in for working people with disabilities. In addition, if an individual would like to save money more than allowable resource limits, there are ways to do that. And so we'll talk about two of those ways: Achieving a Better Life Experience Act, which is an ABLE account, and then a plan to achieve self-support, which is a PASS plan. So benefits advisement resources and information must be within everyone's reach, and anybody who receives any kind of public benefit should be connected to a certified benefits advisor. So every situation and benefit or financial picture is different, and it just needs to be considered uniquely. So if you have a certified benefits advisor that you can go to and talk to, that is terrific. But if you don't, please contact NICE and we can help you find one near you. In fact, in this last year, we have developed what's called a work incentive network, which is a directory of certified benefits advisors across the state. And so when we talk with you about connecting you to a certified benefits advisor, all we need is your zip code, and we will send you information about how to get connected to a benefits advisor. Another thing to consider is having a go-to website for information about benefits. So if you don't have a specific website to go to, we want to help you out and direct you, first of all, to our NICE customer resource page. There's a lot of information on that website page that talks about various benefit types. So this section is going to describe the basic information about each benefit type, SSI and SSDI, and some specific work incentives associated with each. And again, please reach out to a certified benefits advisors to get specific answers about your questions. So let's start with SSI benefits and the work incentives that are available for them. SSI stands for Supplemental Security Income, and the SSI program provides a cash benefit payment to people who have limited income and limited resources. So the resource limit in 2024 is for a single individual, it's $2,000, and for an individual with a spouse, it's $3,000. And what that means is the resource limit is any money or assets that a person has that could be turned into cash. So that would include things like your savings account or any retirement benefits that you might have. So that would be a resource limit. And if you go over that resource limit, the individual will lose their SSI cash benefit. The other thing about that is sometimes these numbers change annually, but in this case, the resource limit has been in place for longer than 10 years, which is unbelievable. It absolutely should have been raised more since then, but it has not. The information on this slide talks a little bit more about how Social Security actually figures an SSI payment. So they first start with $943, which is the federal benefit rate. And then they take a look at a person's unearned income and their earned income and any work incentives that they might be eligible for at that point. So the 943 is the starting point, and they're subtracting unearned and earned income. And then they're also applying the ability to use work incentives to maintain that benefit longer. The other thing about the federal benefit rate is that it does change annually. So that's something to look at on an annual basis. There are several Social Security SSI work incentives that are available for individuals, which actually reduces the total countable income and allows the individual to maintain more of their Social Security benefit check than they would otherwise if they weren't using these work incentives. So a couple of them we want to cover today is the student earned income, the impairment-related work expense, the blind work expense, and the subsidy special conditions. So the student earned income exclusion allows a person who is under the age of 22 to exclude some of their earnings from their income if they are regularly attending school and regularly working. Social Security will then allow them to use this work incentive exclusion, and not count as much income as they would regularly. So in 2024, that amount that can be excluded is $2,290 per month, up to an annual maximum of $9,230. So the big benefit here is that the person who is under the age of 22 can use this benefit. Anyone over the age of 22 cannot. So in our example, a 19-year-old person who is attending school part-time and working part-time, they might earn $1,000, let's say in January. And he contacts Social Security and lets them know that he wants to use the student earned income exclusion for that month of January. And he will be required to submit his wages, which he should already be doing, and send confirmation that he is attending school. And then he can use this benefit each month up to the annual maximum. So if January he earns $1,000 and he uses the student earned income exclusion, and February and March and April and May and June, he can use that all the way for those 6 months, and all the way up until he gets to $9,230. Once he hits that maximum amount, then it stops. It is a new calendar year, though. So in January, it would start over again if he wants to reuse that specific income exclusion. If he earns more than that $2,290 in 1 month, the maximum that can be excluded is still just that $2,290 for that month. So that is a great benefit for individuals who are working and going to school and under the age of 22. The next work incentive that we should talk about is the impairment-related work expense. You might have heard it called an IRWE. IRWEs are costs for items or services that a person needs to go to work because of the disability, and those costs are not being reimbursed by anybody else. Social Security will deduct the cost of that IRWE from the countable income when they determine the eligibility for your Social Security disability benefits. There is also an IRWE approval request form. So what that means is Social Security has the final say on whether something can be counted as an IRWE expense. And so what we have here is the template form that you can use to complete and send it to Social Security for their approval. Now you ask, what could be included as an IRWE example? So there are a lot of different expenses. Could be supported employment services, attendant care, transportation, medical devices. Could be co-payments for medical appointments or co-payments for medications. There's a whole host of things. This is just an example. When we talk about transportation costs, there are some specific regulations. And so I've included this chart that will explain it a little in more detail. Essentially, and we're just going to cover the top part of it, essentially, if public transportation is available in the community and the individual can access it, then the expense cannot be used as an IRWE. But if there is public transportation available and the individual cannot access it, then that cost could be counted toward an IRWE expense. The next work incentive that we want to talk about is called the blind work expense. And this is a work incentive that is very similar to the IRWE. They're both costs for items or services that you need to go to work, and these costs are not being reimbursed by anybody else. However, the blind work expense does not have to be related to the specific disability. Social Security does say that these costs have to be reasonable, and that means that it is something that is customarily charged for the covered or similar services or supplies. And again, Social Security has the final say on whether something can be included as a blind work expense. And again, it's all of the same examples from our IRWE example: supported employment, transportation, medical, co-payments, medications, and doctor's appointments. And there's the IRWE decision chart again. Another SSI work incentives is called a subsidy or special condition. And a subsidy is the extra amount of wages that an employer pays an individual for services over the reasonable value of the actual service performed. Now, you might say, what does that mean? Social Security will deduct the value of the subsidy from earnings when Social Security makes an SGA decision. And that's another definition from Social Security that stands for substantial gainful activity. If you are interested in using a subsidy or special condition, we have to contact Social Security, and Social Security would complete or ask you to complete a work activity report. And you would give this to your employer, and they would complete the form explaining and measuring the amount of the subsidy. So that is doing work at the same amount as somebody else is expected. Maybe it's the same job duties, but you're not, and you're getting the pay the same amount, but maybe your production limit is not to the same amount as everybody else on the team. So you're getting a bit of a subsidy. The special conditions then exist when a worker receives support or services from someone other than the employer, which potentially subsidizes the worker's ability to perform SGA, again, substantial gainful activity. So this would be an example if somebody had a job coach that came to work with them and helped them do portions of their job so that they could be productive and do the job that they needed to do. Any third party can provide the special condition. It doesn't have to be a job coach. It could be someone else. The next section we want to talk about is SSDI benefits and work incentives. So SSA provides a cash benefit to individuals who have worked and paid into the SSA insurance program. And the eligibility for SSDI benefits is based on work credits. So an average adult has to have 40 work credits to be eligible for SSDI benefits. And an individual can earn up to 4 work credits per year. So 1 work credit per quarter, which means that if you have to have 40 and you can get 1 per quarter or 4 per year, that means we're looking at 10 years of work history in order to be eligible for SSDI benefits. SSDI benefit amount is the amount that you receive based on your earnings over those years. So it's not really an average of your earnings. It's based on the amount of money that you earned and what Social Security would deem is what you would need. In addition, please note that the specific rates listed here have the potential to change at the start of each new year. So right now, 1 work credit per quarter, you would have to earn $1,730 in that quarter to get that 1 work credit. The other thing I want to stress about this is the eligibility in this scenario is for an average adult. There are exceptions to this rule based on the individual's age. So that could potentially change if there was a younger person. They may not be required to have as many work credits. These are the SSDI work incentives. So we're looking at the impairment-related work expense, just like from SSI benefits. We have a trial work period, an extended period of eligibility, and the expedited reinstatement. Again, the impairment-related work expense, which is the IRWE, is the same for Social Security SSI benefits. So there are costs for items that you need to go to work because of your disability, and the costs are not being reimbursed by anybody else. Social Security requires that you submit the information to them to get approval before they can be counted on your SSI worksheet. In addition, I didn't mention this before, but it's a good idea if you have a potential IRWE that you keep a receipt for how much money you spent and keep a list of what it was, how much you spent, and the receipt all attached to the same document. These are the same IRWE examples that we talked about before, including the transportation decision chart. The next work incentive for SSDI benefits is called the trial work period. This allows an individual to test their ability to work for at least 9 months without losing the SSDI benefits. So you would receive your full cash benefit, your SSDI benefit check, regardless of how high your earnings might be, as long as you report your work activity and you continue to have a disabling impairment. So Social Security allows 9 months, a 9-month period, to try to go to work and earn as much money as you can. If you earn over $1,110 per month, that's called the trial work level, then Social Security will count that month as month 1 out of those 9 months. So an example, if an individual earns that $1,110 in January of 24, Social Security will count January as that first trial work period month. But if the individual's income falls below the $1,010 in February, then that month is not going to be counted as one of those 9 trial work months. So as you can see in this example, the trial work months do not have to be consecutive. The next work incentive is called the extended period of eligibility. And this automatically begins the month after the trial work period ends. And it is a 36-month period of time in which you will receive your SSA cash benefit, so that SSDI benefit check, for all months that your earnings are below the SGA level, substantial gainful activity level, if you continue to have a disabling impairment. So Social Security came up with trial work level for the trial work period and the substantial gainful activity level for the extended period of eligibility. And that is a dollar amount that they chose to indicate that a person is earning substantially. So in this case, the SGA level is $1,550. So once the trial work period ends and the individual earns over SGA level, that $1,550, the very first time that person hits over $1,550, SSA will start to terminate their SSDI benefits. However, there are 3 months. So there's the cessation month, and then they offer 2 grace period months. And then that next month, the SSDI benefits would be terminated. However, if that individual is still within this 36-month period, and the individual earns under SGA level again, then they will be able to receive their SSDI check again. But it is only within this 36-month period where this happens. It can go up and down based on the substantial gainful activity level that the individual has reached. There is something called an expedited reinstatement. So this is a safety net for people who have successfully returned to work and their SSDI cash benefits are terminated. So the goal, of course, is for the individual to go to work and become self-sufficient. And if they are earning over SGA level, they may then lose their benefit. But if they're being successfully employed and they're earning over SGA level, Social Security looks at that as a very positive thing. But during that process, once the earnings have been terminated, if within 5 years the earnings fall below that SGA level, then the individual could get their benefits started again right away through what's called the expedited reinstatement. You would call Social Security and say, I have been hospitalized and therefore lost my job, and I am below SGA level. I need to have expedited reinstatement of my SSDI benefits. Social Security will have 6 months to determine whether or not you're entitled to get your benefit check back. If they say yes, then your benefits should pick up right where they left off. If they say no, you may be required to reapply for SSDI benefits. And in some cases, the individual's symptoms have improved, but now there's a new diagnosis. And so if the entitlement was based on a previous diagnosis that is no longer accurate, you may have to reapply for benefits based on the new diagnosis. A good thing about this process is if you are below SGA level and you ask for an expedited reinstatement, you can also ask for the SSA to give you the benefits while they're in this review process. And even if they say, no, you're not entitled to the benefit in the future, you don't have to pay that benefit back that you got during this review period. So that's a huge benefit for individuals. The next really important topic is about healthcare. People are concerned about going to work and losing their healthcare benefits. So there are a couple of provisions that are available for individuals to maintain their Medicaid coverage, even if they lose their SSI benefit. The first one we'll talk about is 1619B, and that's a special Medicaid rule that allows an individual to maintain Medicaid coverage even if their earnings become too high for an SSI cash benefit. So if you're eligible for 1619B, it will be an automatic process. Social Security will take care of it and change it over automatically to the 1619B provision. But we do have a template letter on our website that will allow you to alert Social Security that this is going to happen so that they are prepared, they see it, they have it, and there's less of a lag in time before that happens. There are some eligibility requirements that are important to remember, that you have to have been eligible for SSI cash benefits for at least 1 month. In addition, you would be eligible for an SSI cash benefit, except that your earnings are too high. You must also be disabled and meet all of the other eligibility rules, including the resources test, and you need Medicaid in order to go to work. It also requires that you have a gross earned income that is insufficient to replace SSI or Medicaid. So oftentimes individuals will get, a raise at work, they're making more money, but they still can't afford the employer's health care. Or the employer's health care are not going to be paying for your personal attendant that has to go to work with you. So there are a lot of reasons for individuals who will want to maintain their Medicaid coverage instead of buying into their employer's health care. And to maintain Medicaid through the 1619B program, there are both income and resource limits, just like SSI. The resource limit remains the same. Like SSI, it's $2,000. But the income limit allows an individual to earn up to $52,286. Now, again, these numbers may change on an annual basis as well, but right now, that's what they are. There's another program that is a great program for people that I think is underutilized. It's called the Medicaid Buy-in for Working People with Disabilities. And this program offers Medicaid coverage to people with disabilities who are working and earning more than the allowable limits for regular Medicaid, and it's free. So the name is misleading. There is not a buy-in at this point. It is free, premium-free coverage. An individual can have a gross income as high as $73,932 and up to $99,636 for a couple. In addition, when you take a look at this, you are allowed to have resources, and they're higher, of course, than the regular Medicaid and 1619B. The resource limit is $30,182 for one person and $40,821 for a two-person household. There is a Medicaid buy-in toolkit in the process of being updated right now because we have some tremendous changes happening in January. So we want to also talk with you about that, but the toolkit link, you can still get to it and use it, but it is in the process of being updated. The other thing I want to say about
around 5 minutes before we start taking questions.
Okay, thank you.
No problem. So everyone just send in your questions to the chat when you get a chance. Thank you, Lisa.
The other thing I wanted to mention about the Medicaid buy-in is that even though 1619B is an automatic process and Social Security will help you with that, the Medicaid buy-in is something that the individual actually has to apply for. So you would have to actually go in and apply for this benefit. In January, these are the terrific changes that are going to be happening. Right now, Medicaid buy-in has an age limit at 65. In January, they're going to get rid of that age limit. In addition, the asset limit is going to be expanded to $300,000, and the income limit is looking at $320,000 annually. So those are tremendous. The other caution I would have on this is right now, there is no buy-in, but if an individual is earning over $300,000, there may be a premium attached. I don't have that information, but it's just something to consider. In addition, we want to talk briefly about Medicare. So most of the people who get SSDI benefits also are eligible for Medicare coverage. And following that trial work period, individuals can continue to receive at least 93 months of Medicare coverage, which includes Part A, Part B, and Part D if they've already been enrolled in those programs. So that is a huge benefit. That's over 7 years of 9 months of being able to maintain that Medicare coverage. In addition, after premium-free Medicare coverage ends due to work, you can still buy continued Medicare coverage as long as you remain disabled. And I know that we're running out of time, so I will go through this quickly. There are ways to save money. An ABLE account is one. It's called Achieving a Better Life. An individual has to have had a disability present before the age of 26 and one of the following: classified as blind, entitled to SSI or SSDI, have a disability that is included in the list of compassionate allowance conditions, or have a written diagnosis from a licensed physician documenting a medical, determinable physical or mental impairment. An ABLE account is a savings program for eligible people with disabilities who have resources that would make them ineligible for other benefits. So for example, if a person receives a $10,000 inheritance and they put that money in a regular savings account, they're automatically over the resource limit for SSI and they will automatically lose their benefits. But if they put that money in the inheritance in an ABLE account, it will not count toward the resource limits and they can maintain their SSI benefits. An ABLE account can be used to pay for medical and living expenses in order to maintain a person's health, independence, and quality of life. An individual can contribute up to $18,000 annually and a total of up to $100,000 without it impacting SSI eligibility. There's more information on this slide about how to contact New York ABLE to talk about opening an account. Past plans, those are from Social Security, a plan to achieve self-support. A past plan allows a person to set aside money other than their SSI for a specific time period so they can go to work and achieve their goals. So if an individual needs a car to help them go to work, they can set up a past plan to save money and buy a car, and then helps them get to work. They could also buy a computer if they need to have equipment when they're in school. So it's actually a plan to put together to save money for a specific goal for work. It can be completed by anybody, but it has to be approved through Social Security. There's more information on that. I think that we're out of time, but there's information on the Ticket to Work program that might be beneficial. And there are some resources at the end to talk about various, like our website, and then New York ABLE, past plans, myths and facts, and a job seeker's guide. We also have certified benefits advisors, as I mentioned in our directory, but here are some contacts if you would like to reach out on your own. Thank you very much for joining me today, and please share your questions.
Thank you so much, Lisa. You did really, really great. That was so informative. We do have lots and lots of great questions coming in. So the first one we have is how do we transfer benefits when moving county to county?
And you're talking benefits like SNAP benefits that are dependent on where you live?
Yes.
Yes. That's a really great question, because it's not, it shouldn't be complicated, but letting the FSSA office know that you're moving would be the first priority, getting connected with that new provider in the new county. And I think just talking with your claim representative at the current location to ask them what their specific transfer would look like. Sometimes it can be easy, sometimes it's more complicated. So I think it depends on where you live and what county it actually is. I don't think it's a uniform process.
Okay, thank you, Lisa. What is the downside of the Medicaid buy-in program?
Oh gosh, that's a good question too. Honestly, I can't think of a downside. It allows an individual to go to work and earn a lot of money and still keep their benefit coverage. The huge benefit to that is being able to, like, if they're not able to get their employers or their employer insurance doesn't cover specific services that they're currently getting, the Medicaid buy-in program allows that rollover. So you're not changing Medicaid. You're not losing your doctors. You're not losing your medications. All of that would stay the same. So I can't really think of a downside.
Awesome, thank you. Can a person who is 18 or older, so sorry, I lost the question. Give me 1 second. How about this one? Do we have to report the existence of an ABLE account to Social Security?
My first thought is no. You have to report your income to Social Security. Social Security will have the information because they get wage data and data from the IRS. So they have information about it already. So I don't think that you have to make a point to say that you're doing that. I think they'll just know.
Awesome. Okay, my son is receiving survivor's benefits. How long does that last? He's currently 13 years old. Do the same rules apply for him to keep Medicaid?
So the information I provided today is all about adults. So the youth information is a little different. And if you would like to talk more about that, please let me know. You can reach out to me and I will help you kind of walk through that. And yeah, it's just a little bit more complicated. It's not the same. No.
Let's see. So many good questions. It's hard to choose. Can an adult with disability and Social Security and SSI benefits get half of the parent's retirement benefits if both parents receive those retirement benefits?
There are provisions for that. Yes. Yes.
And are the certified benefit advisors that we access by contacting NYESS also available to advise families of school-age children with disabilities who are interested in applying for benefits?
I think yes. So my first initial thought is yes on that. If you haven't applied for benefits yet, they can walk you through the pros and cons of doing that. They typically take a look at the benefits you're already getting and then could put together a plan for how they will be impacted when you go to work. But they can talk about any benefit. So it can be childhood disability benefits. It can be, any of the public benefits as well. So yes, they could do that and talk with you about the pros and cons. I don't think that they will help you apply for Social Security benefits, but they could advise you on the pros and cons.
Got it. Thank you. Alrighty. Can a person If a person works 20 hours a week and reports wages at the month, it requires, if they make at the end of the year under 25,000, do or do they not report taxes?
Gosh, you guys have a lot of great questions. These are awesome. So there's some back and forth about whether or not a person should report or file taxes. There are some benefits to doing that. So I would think it would be a positive thing to do to file your taxes. If you're below that 25,000 and you're not required to do it, you wouldn't have to. But we always, in our business, in my business, we always encourage people to do it regardless of the amount of income. So if they worked and they earned under 25,000, you file your taxes, likely you'll get the refund.
Thank you.
Mhm.
Alrighty, we have another one for you. Can a person with a disability who is 18 years old or older receive SSI if they are in college or post-secondary school but not working?
Let's see, disabled, going to school, SSI benefits. Yes, they certainly can do that. They can get SSI benefits. It depends on the situation. Every situation is different. So I would have to know more detailed information to kind of say for certain, but generally speaking, yes, the answer is yes.
Okay. Are WIPA counselors considered to be certified benefits advisors?
WIP?
WIPA counselors.
Yes. Okay. So what you have there is a WIPA, and that's the work information planning something. But they are, so the WIPA program is through Social Security, and Social Security, each local office should have a WIPA in their office or associated with their region. And the WIPA is a certified benefits advisor, and typically, can provide the same information that another type of certified advisor can give. So yes, it's through Social Security. It's a more formal training specifically for them at Social Security, but it's the same as a certified benefits advisor. And the answer is yes. Sorry, I'm so long-winded. I could talk about it forever.
No, you're doing amazing. Yeah. I think this might be our last question. Maybe we'll have time for another one after this. But
Okay.
if the SSI application is denied, what documents should we add to appeal?
Another terrific question. So the thing about SSI and SSDI, Social Security is looking at the individual's disability. So if a person is getting SSI or SSD, they have to meet the definition, the adult version of the definition for disability with Social Security. And so I would, dig that definition out. It's about a person who cannot earn substantial gainful activity, that SGA level, that 1550. It's about that, and it's about a disability that is going to last longer than 12 months. So I would take a look at those two things and make sure that you have documentation that supports that. Also, I would recommend having a diagnosis from your medical doctor or other practitioners, medications that person is taking. I would provide all the proof of that disability that you possibly can.
Thank you. Okay, now this one I think will probably be our last one. But are there any programs or benefits that help you pay for speech and occupational therapy that are private pay costs?
Wow, that's a great question too. And I don't have a clear answer for that. That is something that I could pull up some resources for you. I don't have them off the tip of my tongue. If you would like to reach out to me via email, I would be happy to do some research on that and see what I can find.
Alrighty, thank you so much, Lisa. You did such a fantastic presentation. Thank you everyone for your questions. They were really good questions.
They were.
Yeah, they were really
Yeah.
good. I'm sorry if we couldn't get to all of them, but if you do have more questions for Lisa, you can email her or you can email Family Summit at communitynetwork.org. Thank you all for joining us today. After this event, you're going to get a survey, and if you take that survey, you could win an Amazon gift card. So make sure you fill that out. And now I'm going to reintroduce our Chief Operating Officer, Linda Law, for the conclusion of the event. Oh, but before we do, Lisa, would you mind saying your email one more time?
Absolutely. So my email is Lisa, Lisa, Brown, BROWN, then the number 2 at omh.ny.gov. And thank you so much for having me, Selena. It was terrific. And I look forward to communication.
Awesome. Thank you, Lisa. And now we'll hand it over to Linda. Thank you, guys.
Hi, I'm going to be jumping in for Linda. I'm Tracy Picard. I met some of you at the beginning of the session. I just want to thank Selena for the introduction and thank all of you for joining this year's Family Connect conference, Creating the Future. Whether you joined us for one session or for the whole day, we hope that you discovered new resources and support. Following today's events, you will receive a survey about this year's conference, and by completing this survey, you will be entered to win a $25 Amazon gift card. Make sure to follow Adapt on YouTube and also at Adapt We Change, and then you can hear all about all of our exciting programs and also when these recordings become available. We tried to get to all of your questions, but if we didn't get a chance to get to them, please email Project Connect at adaptcommunitynetwork.org. Thank you, everyone, and enjoy the rest of your day.